From the state capitol, WFSU Public Media brings you Capitol Report.
The race for Florida governor heats up as an R-D jumps into the contest.
I think, having spent so much time in the independent space, I am fully convinced that an independent cannot win the governorship.
Also this week, we'll have a conversation with the ever-outspoken John Morgan, who thinks a third-party candidate can win the Florida governor's race, especially if his name is Morgan.
In my Brooklyn office, I have a sign when you walk in. It says, "Done is better than perfect."
We'll also hear about the new Florida law intended to help kids on the autism spectrum and hear from dental professionals who fear the state's new fluoride ban won't help kids, or grown-ups either. I'm Tom Flanagan. Online and on air, this is Capitol Report and the end-of-week wrap-up of top stories from Tallahassee. Former Republican Congressman David Jolly left the GOP amid the rise of the MAGA movement over 6 years ago. Now he's switched his party affiliation to Democrat and has announced he'll be running for Florida governor in 2026. Tristan Wood spoke with Jolly about why he's running, even as Republicans say the former congressman has no chance to win.
On the top floor of the Governor's Club, a block from the state capitol in Tallahassee, Jolly held meetings with members of the press to make his pitch for why he should be Florida's top executive.
I'm running for governor of the state of Florida because we are in a generational affordability crisis that's impacting every Floridian from every region and every socioeconomic bracket and every partisan affiliation. The affordability crisis is impacting access to housing, the ability to stay in one's home. I think people are anxious considering whether they can stay in Florida. I think Republicans in Tallahassee have largely contributed to the crisis and refuse to do anything that will actually address it.
Jolly was first elected as a Republican in Congress representing Pinellas County in 2014, but was unseated by fellow Republican-turned-Democrat Charlie Crist in 2016. Since then, he registered as an NPA, meaning no party affiliation, and was a political contributor on MSNBC. Now he's changed his party to Democrat. Several Republicans say they are happy he is running.
I know we're all excited that Timu Charlie Crist announced that he was running for governor.
That's Evan Power, chair of the Republican Party of Florida. He's calling Jolly a knockoff of Charlie Crist, who made a failed gubernatorial bid in 2022 and lost by over 19 points. Power thinks Jolly will face a similar margin.
Well, Charlie Crist has at least won statewide elections and won elections. And David Jolly couldn't win a statewide election, so he went and became a never Trump TV commentator. He failed at that, and now he's trying to reinvent himself as a Democrat. And, you know, the old joke about Charlie Crist is a Republican, a Democrat, and an independent walked into a bar and they said, "Hi, Charlie." I guess we can all say hi, Timu Charlie Crist now.
But Jolly says he's planning to run a different style campaign than his predecessors that looks to build a big tent party-hopping coalition.
Show me a Democrat that has gotten up every day and talked about the affordability crisis with real solutions. And show me a Democrat that has been in every community around the state, red communities, purple communities, blue communities, and said, "I have solutions for the affordability crisis, and this is what they look like." I haven't seen that candidate.
Jolly isn't the only candidate who has switched political parties recently. Former Democratic State Senate leader Jason Pizzo switched party registration to NPA and has filed to run for governor. He has also publicly said he believes the Democratic Party is dead. Jolly says he respects Pizzo for following his political convictions, but disagrees with his strategy.
Now, I think he is wrong to suggest that Democrats can't lead a coalition of change. I think, having spent so much time in the independent space, I am fully convinced that an independent cannot win the governorship in 26 in the state of Florida. That's an absolutism. An independent cannot win. But my job is not to try to convince Jason Pizzo about his decision or John Morgan about his. My job is to build a coalition where I reach those independent voters that are disaffected.
Power thinks those other candidates running are essentially the final nail in the coffin for Democrats in the gubernatorial race.
If you look at the last couple of elections, we won the gubernatorial election by 20 points. We won the presidential election by 13 points. There is only so many anti-Republican votes out there, and if John Morgan, Jason Pizzo, David Jolly want to split up that 40% of the electorate. I wish them all well. The fact is we're going to have a Republican governor, and that governor is going to lead our state forward.
There's over 1 million more registered Republicans than Democrats in Florida now, and Republicans have dominated in the last several elections, winning over swaths of NPA voters. Jolly, or whoever the Democratic nominee ends up being, will have to make significant inroads with NPA voters to put the governor's race in play in 2016. I'm Tristan Wood.
Psst, hey, want to be part of a new political team? Well, for centrists who feel the GOP and the Democrats are too extreme, lawyer, entrepreneur, philanthropist John Morgan is recruiting. The so-called pot daddy joined the Deeper Dive with Derek Ham podcast to dish about his serious consideration of a run for governor.
The way I look at it I've watched politics nationally, state, and what do I see? I see two parties that are so far apart and getting further apart every single day, driven by the fringe on each side. Then what I see from my perspective is all these ballot initiatives that have happened and passed with over 60% of the vote, which, as you know, is a landslide. Mm-hmm. My conclusion from that is that most of us agree on most things: marijuana, felons' rights, minimum wage, fair districts. It goes on and on.
Universal pre-K. We could go on and on.
We could go on and on. Right. But what we know is none of those are ever going to happen in the Florida legislature, ever, because legislators are wholly owned by special interest. And they're there for, the leaders are there for 2 years to have their resume. I'm the president, I'm the speaker, and then they go home and they did nothing for the people. So what do I think is missing? I think that the missing link, and I could be wrong, but I think the missing link is the two-party system. I believe that the two-party system is the problem. If you had a third party where no party had the majority, then you'd have to do something that none of these people seem to ever want to do or ever mention the word, which is compromise. If a legislator says, I'm going to compromise, they're going to be voted out of office by their party. The left and the right want all or nothing. In my Brooklyn office, I have a sign when you walk in. It says, done is better than perfect. And I like that because I'd rather have something than nothing. And so my thought is a third party. People running for independent, I don't really know Jason Pizzo, but I understand his frustration. I understand what his frustration is. And I understand what some of his caucus's frustration is with him. Okay, so it doesn't make you bad. It just makes you disagree. But what I believe is that we as people, as voters, we want to be on a team. We want to be on a team. How many times have you ever gone out in public and seen a jersey with no logo, no name, no number? We want to be on a team. And my thought, and I say I could be wrong, my thought is if you had a team that people could say, this is my team, not NPA, not libertarian. I mean, libertarian is basically like, here's what we want to do. We want to ride motorcycles with no helmet. We want to be able to smoke marijuana in public. We want to be able to smoke cigarettes at the airport. It's our body, our life. Don't tell me what to do. And by the way, I might be libertarian, but you need a sane party. NPA, Green Party is too narrow. But there's a bunch of us, and I've used this line before in my speeches, it's the song Stealers Wheel. You've heard it. Jokers to the left of me, clowns to the right.
Yes, here I am, stuck in the middle with you. With you.
With me, with you. That's the party. That would be our party theme song, stuck in the middle. And so I believe that there's people, I think there's, I don't know how many independents out there, 30-something% maybe, that could go along with it. It's like, hey, are you pro-choice? Are you a Republican? Are you pro-choice? Yeah. Are you a Democrat? Are you pro-choice? Okay, are you a Republican okay with marijuana? Yeah. Are you a Democrat? Okay. Okay. And you start adding all these things up. And before you know it, you got a party where we don't agree on everything, but we agree on 80% of everything. We don't need everything. Done is better than perfect. Something is better than nothing. And that's what I'm thinking. So we'll see.
That was John Morgan on the Deeper Dive with Derek Ham podcast, a product of the News Service of Florida. You can hear the full episode wherever you get your podcasts. Coming up on Capitol Report, Florida kids on the autism spectrum are expected to get a lot of help from a newly signed law.
So that's the design of the bill. Let's get these kids help at the earliest possible moment of intervention, and let's make it quality.
Why is there such a stubborn shortage of nurses? One nurse educator says part of the problem lies with the students.
They are not mentally prepared for the rigor of the program.
And we'll hear from some dental professionals who fear Florida's new law banning fluoride in public water supplies will lead to a big jump in kids' cavities.
It's about more than just having a nice smile. Children in pain can't focus in school, they can't eat properly, they can't sleep.
Governor Ron DeSantis has signed a major bill aimed at increasing early detection and intervention for children with autism. It also works to fill in the gaps in children's education with specialized programs. More on the story from Margie Menzel.
Angela Nandine has 3 sons with autism. They're thriving, she says.
And they are thriving in their own ways. And I am their voice. It is hard to understand them, but they are still thriving for who they are and where they are in life. And they're happy. And my husband and I are constantly educating ourselves in how to understand them better so we can meet their need so that they can have the best life they possibly can have.
Nandine is known as Big Ange, even in the halls of the Florida legislature. She says it's because she gets the job done. Her twin sons are 12 and her youngest son is 10. She found out they were autistic early on.
We weren't meeting milestones, and we did early intervention, and that's how they got diagnosed.
Because you were paying close attention.
Yes, very close attention.
And that early intervention was essential, Nandine says. That's why she backs the new autism law, which expands free screening and early detection opportunities. It also directs the Department of Health to apply for federal approval to extend eligibility for services under the Federal Individuals with Disabilities Education Act. That means children with developmental delays or disabilities would be able to continue receiving early intervention services in the Early Steps program until the child turns 4. Stephanie Norden has 4 teenage sons. The 2 oldest are 15 and have what she describes as severe cases of autism.
They had to wear helmets. When they would get frustrated for not being able to communicate their needs, they would just bang their head into the concrete, a wall, whatever. They slept in safety beds so that in the middle of the night, they wouldn't hurt themselves. They have neurological differences which impact their ability to understand when they're tired, so they don't sleep very much.
Norden is the founder and executive director of Autism Collier Resource Center and the co-founder of Autism Collier Charter School. She leads an advocacy group for families engaged with the Agency for Persons with Disabilities. She says part of her learning curve was realizing that the rest of her community had a lot to learn as well.
The boys have been on wait lists for years to get services they need to be able to have a meaningful life. And even those services have been very difficult to navigate. We do have a crisis of insufficient workforce.
But on the other side, Norden says, is the joy.
They are purely joyful. There's no inhibitions. They're purely mad too. But I know what I get with my boys, and they are sweet, wonderful young men who I am wildly excited to see transition into their next phase of life, but it has been a road.
The twins were diagnosed when they were 1 year old, thanks to a close friend who's a pediatric nurse. Norton says having more people in the community with the skills to recognize and support people with autism is crucial. Under the bill, the University of Florida Center for Autism and Neurodevelopment will develop a micro-credential so that instructional personnel can learn skills to help students with autism.
So that's the design of the bill. Let's get these kids help at the earliest possible moment of intervention, and let's make it quality. You know, having that micro credential for the workforce is not just going to help the kids, it's going to help the workforce.
The new law was a priority for Senate President Ben Albritton, who championed the measure this year and later learned that his grandson, Brooks, has autism.
The good news is that many of the things that we've learned through all of this is already yielding results. But I'm convinced at this point that the biggest reason that we've been through all of this in the legislature is because of him. We didn't know it, but it's presenting itself now, and it's good. It's all good.
Albritton says he's committed to helping children and families with autism, and he's willing to put in more work next session if necessary. But he thinks this new law is a good start. I'm Margie Menzel.
The healthcare industry makes up a big part of Tallahassee's economy, but the city is still facing the same nursing shortage plaguing much of the state. The latest U.S. Census data reports healthcare is now the third largest industry in Tallahassee, behind only educational services and public administration. In fact, as of 2023, the latest year for which numbers are available, just under 14% of the capital city's workforce, more than 14,000 people, were in medical and related fields. That's a lot of people, but when it comes to the number of nurses in that overall figure, Stephanie Solomon, Director of Nursing at Tallahassee State College's Gasvini Center, says there just aren't enough.
The need is, of course, very great. Being able to meet the need, we are doing our best here at Tallahassee State College to meet the community need for healthcare workers.
Tallahassee isn't alone. The National Institutes of Health projects more than 275,000 additional nurses will be needed nationwide between now and 2030. Florida's statewide nursing shortage will be around 60,000. The same report says job opportunities for nurses will grow by a faster rate than all other occupations, at least through 2026. But Solomon says there are obstacles. One of them, she says, is that many students simply aren't ready to take on the educational demands.
They are not mentally prepared for the rigor of the program, not knowing how to balance between their studies and their personal life. They are lacking time management skills. They are lacking effective coping mechanisms. They're not able to handle the stress and the anxiety of being in a professional educational program.
But Solomon says there are efforts in place to help students prepare for the rigorous program. She applauds both of Tallahassee's hospitals for providing scholarships and tuition reimbursements for employees, including nurses, who aspire to career advancement. And she says the launching pad for those jobs even extends into the area's public schools.
I do know that Leon County schools offer, I think they call them health careers academies in some of their schools. So there are those opportunities for those students. Like they have a CNA program. We are partnering with Godby High School where we go in and we offer our EMT program to some of their high school students.
All of this helps, but Solomon says there's another obstacle that's proving a major choke point in the nursing pipeline.
We are at a deficit for nursing educators. I can't educate future nurses if I don't have instructors.
The National League of Nursing agrees with Stephanie Solomon. Its latest nursing education research report pegs the nursing shortage directly to the shortage of nursing educators. Another concern in the nursing field is retention. That's something Dale Neely, the new CEO of HCA Florida Capital Hospital, knows something about.
You know, we're no different than any other hospital in the state or in the country for that matter. The nurses are hard to find. So really what you want to do, you want to make sure that when you bring the nurses in that you keep them here. So you got to support them. You got to make sure they have the resources that they need to do their job, that they feel like they have those tools available, that they feel like they are supported.
Data from the Florida Hospital Association's 2024 report shows retention rates have improved since the coronavirus pandemic, which greatly exacerbated nursing shortage issues, but officials say there are still improvements left to make. Ready for some weekend fishing at a discount? Like free? Well, coming up this weekend and next, anglers in Florida who want to get outside can catch their dinner at no cost by taking advantage of 2 license-free fishing weekends. On Saturday and Sunday, June 7th and 8th, no license will be required to go saltwater fishing. The following weekend of June 14th and 15th, people can go freshwater fishing without a license. Both Florida residents and visitors can take part in the license-free weekends as long as they follow the normal size and bag limit restrictions. Florida Fish and Wildlife Conservation Commission officer Chris Bawley says free fishing weekends are a way to introduce the sport to new anglers.
Florida is the fishing capital of the world. We have a lot of awesome fish out there. It's a great way to get outdoors, get involved, get in touch with nature and our great state. And so we offer that as a way to get people into fishing that might be interested.
For those who enjoy their free fishing experience, an annual license for fresh or saltwater fishing costs $17 each for residents and $47 for non-residents. You're listening to Capitol Report from WFSU Public Media. I'm Tom Flanagan. Finally this week, more than 1 million children in Florida miss out on dental care each year. Access is especially hard for kids in rural areas or whose families have low incomes. WUSF's Stephanie Colombini reports some dentists say a new statewide ban on adding fluoride to drinking water could make the situation worse.
Mornings are always busy at Suncoast Community Health Center's pediatric dental clinic in Brandon. Hallways buzz with sounds of drills and suction tubes. Dentists tell kids you're doing awesome as they sit through procedures. Inevitably, there are some tears, too. Children come to the clinic for the usual teeth cleanings and cavity fillings. Then there are cases Dr. Tiana Wallach says hurt her soul.
We've had children who were 3, 4, 5 years old were pulling 16 of their 20 teeth due to cavities.
Those are last resort situations Wallach says could be avoided if kids had better access to affordable dental care. But in a state where nearly all counties don't have enough dentists to meet demand, families with low incomes have limited options.
Most of the time when they come to us, it's like the end of the road.
That's Dr. Aura Cisneros, Chief Dental Officer at Suncoast. The group gets federal money to treat Medicaid patients and offer discounted care to people without insurance. It's a huge help for parents like Santiago Gomez. At the clinic, he explained in Spanish his 5-year-old son's Medicaid would pay for the stainless steel crowns he needed. But Gomez says finding a place to accept that coverage was difficult.
Frustrado porque como no saben lo que está pasando ahí, pero imagino que es un dolor que tienen ellos todo el tiempo por eso.
He's frustrated, he says, because he doesn't know what's going on with his son's teeth, but knows he must be in pain all the time. Dr. Cisneros says most Florida dentists don't take Medicaid. The state's reimbursement rates are among the lowest in the nation. So of the 3 million kids who were eligible for Medicaid dental services here in 2023, fewer than half received any. For decades, kids who can't access regular dental care have had at least one line of defense against cavities: drinking water with fluoride in it.
Fluoride is definitely very important because it is a way to prevent.
Most dentists agree when added to water at recommended levels, fluoride is safe and helps strengthen teeth and prevent decay. But a new state law bans communities from doing so. When he signed the bill in May, Governor Ron DeSantis pointed to studies that link consuming higher amounts of the mineral with negative side effects. He says the ban is about giving families a choice.
Yes, use fluoride for your teeth, that's fine, but forcing it into the water supply is basically forced medication.
Several Florida communities already started removing fluoride from water amid concerns raised last year by officials like State Surgeon General Joseph Ladapo. DeSantis says families can get fluoride in toothpaste or by visiting the dentist. Cisneros says that's not a given for people struggling to meet basic needs.
Families of more than 5-7 people, sometimes the kids are sharing the same toothbrush. Sometimes they are keeping the same toothbrush for a whole year. And it's all bended and bad and, in bad conditions, and they are still brushing with the same because they can't afford simple stuff like that, because it's better to buy the milk or to buy, the bread instead of like a toothbrush or a special toothpaste.
And that's why dentists like Dr. Michelle Thomas say banning fluoride from water supplies hurts underserved residents the most. She treats children on Medicaid at a clinic in Panama City.
It's about more than just having a nice smile. Children in pain can't focus in school, they can't eat properly, they can't sleep.
Dentists are especially scarce in rural areas like Florida's Panhandle. Finding ones who specialize in treating children is another hurdle. Thomas says some families have to travel hours for appointments.
And so oftentimes their first visit to a dentist is because they're having dental pain or a major dental issue that wills them to travel the long distance.
Critics of fluoride say they have evidence it doesn't work. Despite its presence in many water systems, millions of Americans have untreated tooth decay. But the Centers for Disease Control and Prevention says adding it to water reduces cavities by about 25% in kids and adults. Fluoride is by no means the only solution to improving dental health, but Thomas says removing it from water exacerbates a crisis that's already not getting the attention it deserves.
And it will be even more important to have enhanced access to care, because I do anticipate that the number of cavities will increase significantly.
State health officials say they are working to expand care. In an email, the Agency for Healthcare Administration says it recently increased Medicaid reimbursement rates for preventive dental services. These include cleanings, sealants, and fluoride treatments. And the Florida Department of Health partners with community health centers like Suncoast to provide routine care in some schools. Back at the Suncoast Clinic, dentist Tiana Wallach says more needs to be done to help kids who already have damage, regardless of their family's ability to pay.
Because we traumatize children, essentially, when they are put in these situations that they didn't put themselves in.
She says that means investing more on Medicaid payments for complex procedures and offering more incentives for dentists to work in underserved areas. It's a tough demand as federal lawmakers consider cutting Medicaid. But Florida dentists say kids can't afford for the status quo to continue. It's more care that they need. I'm Stephanie Colombini in Tampa.
Our regular Capitol Report correspondents are Gina Jordan, Regan McCarthy, Margie Menzel, and Tristan Wood. Thanks also to Derek Ham and Stephanie Colombini. Technical support for Capitol Report comes from Taylor Cox, and I'm Tom Flanagan. Join us again next week, online and on air, for more reports from the state capitol.
Capitol Report is a production of WFSU Public Media in Tallahassee.